Welcome back to News Up Extra on Silverbird News 24. We apologize for the technical glitches. It is due to the heavy downpour. We know it rained really heavily yesterday in the nation's capital. Okay, so before the break, we were speaking with somebody in aviation, the aviation sector, about the warning strike that, they are proposing. And now, the health sector commenced their strike on Thursday, and it is indefinite, according to them. Part of their demands are the approval of implementation of the technical committee report on CONS adjustment by the federal government, and of course, COVID-19. That was 3 years ago, thereabouts. The implementation that does the immediate payment of the omission and shortfall of the COVID-19 hazard allowances. Now we have Dr. Ogbonna Obinna. He is the Vice Chairman, Joint Health Sector Union, JOESU. Yes, apologies. He's going to be talking about promoting industrial harmony in the health sector. Tell us about the indefinite strike and why you have decided, why the union has decided to embark on the strike.
Okay, thank you for having me. I want to appreciate the Nigerian children today being their Children's Day celebration. All Nigerian children, I wish you well. You will grow up to become great in this nation and beyond. Thank you for the question concerning the indefinite strike. Well, in the health sector, we have a peculiar issue there. We are supposed to work as a team. Yeah. And when you have a team, one person cannot make up a team. And because we call ourselves medical team or health team, the contribution of each person matters a lot to the effective service delivery and well-being of the patient that is in the middle. The patient is in the middle. All of us surround the patients to give our specialty services to the patient. If you, who is a caregiver, you are not being taken care of, how will you have the wherewithal? Where will you have the impetus and the motivation to give in your best? We have seen over the years that in the health sector, there is an element of discrimination against other healthcare professionals apart from the physicians. And this had its origin from the structural design, whereby you have a physician as the Minister of Health. The two ministers we have, we've been having during the inception of President Muhammadu Buhari's era, had been both of them, Minister for State and the Minister, all of them had been medical practitioners. It was just of recent that a lawyer was added to when Dr. Mamora was taken away to Ministry of Technology, that we had Akama as the Minister for State. Now, the storyline is this. In 2014, precisely 2nd January 2014, the consolidated medical salary structure was adjusted. And in 2009, when there was when CONHES and COMES, CONHES is consolidated salary structure for other healthcare professionals, while COMES is consolidated health salary structure for physicians. The CBA then declared that whatever tilting or adjustment that you do to one should be proportionate to the other. So in 2014, the COMES salary structure for physicians was adjusted. We are waiting for that of CONHES, which is for other healthcare professionals, to also be adjusted. And we made various inroads, calling the attention of the government with various dialogues and meetings to get this done. It wasn't done, and it snowballed from that 2014 till this moment. It has not been done. But fortunately, in 2021, there was a strike action that we embarked upon, which was apprehended by by the Minister of Labour, Dr. Chris Ngigi. He was the conciliator, and he asked us to go back to Mother Ministry to go and negotiate, and the technical committee was set up, chaired by the Salaries and Wages Commission chairman, and they were asked to work, and they finished their work around November 2021, and the report was ready and was taken to the Federal Ministry of Health with beautiful recommendations that would have assuaged the situation. But the present Minister for Health, Dr. Osagie Ehanari, in his own wisdom and with that coloration of discrimination, instead of taking the reports to the FEC for approval, he decided to keep it under the carpet. And to now add salt to injury, 2 weeks ago, it was clear that the NAD, that is the National Association of Resident Doctors, went on a 5 days running strike. And during the process, they were also invited. They negotiated with them again for another upward review of commerce salary. And the news around the town is that they have reached another CBA for it to be adjusted or upgraded by another 25% upward review, while the commerce salary has been kept perpetually at that starting point. We see this as injustice, discrimination, nepotism, and it is not a fair deal to other healthcare professionals who are team players. Now, again, it doesn't only stop there. We have had several court judgments that are in favor of other healthcare professionals. Like, for instance, the medical laboratory scientists in the system are professionals who are autonomous. They are supposed to reach the peak of their career and head their departments. But we see it presently in Nigeria that pathologists who are physicians, who are not trained as medical laboratory scientists, are lording it over the medical laboratory scientists as the head of the department. This causes a lot of disharmony in the system. Look at another one, just recently, in 2021, the head of service, through the instrumentality of the National Council on Establishment, approved the consultancy status for pharmacists. And the circular was written by the head of service, even though she's a physician. But she saw the clarity of law and that the pharmacists have gone through the hog of making it to become consultants in their field. And the letter was written to the Federal Ministry of Health with another circular emanating from the Federal Ministry of Health to all CEOs of health institutions to implement same. But the Federal Ministry of Health, under the watch of Dr. Osagie Ehanari, has vehemently refused to obey that circular. And he has asked all the CEOs not to also obey that. These consultancies cater for pharmacists. So all of this and other peculiarities, example again that we are bringing to bear. You see, in Nigeria, we want to be treated as honorable people, valuable people who are adding value to the lives of people. The issue of peculiarity allowance also is part of the demand, because if the true reason why peculiarity allowance was given to other core civil servants was because of the present economic situation, we all are Nigerians. We also go to the same mall, markets and all that, and we are contributing. We are even adjudged to be an essential service provider. So if we are that, we should also be treated essentially and valued.
Okay, all right. Part of the demands that touched me is the COVID-19 inducement and allowances, hazard allowances. It's 3 years on since 2020, and I know, particularly because I covered a lot of the happenings, the health workers were on the front line. So 3 years on, what has the body been, your body been doing to make sure that these hazard allowance were met? Of course, there have been warning strikes and everything. Was there just warning, reassurance, and you went back and waited till the dying minutes that the administration is about to hand over to another administration? I know that it is continuing, but what has the association been doing?
Yeah, thank you very much. You know, the set of persons in our union, we are professionals and we know the essence of life and our contributions to the health system. We don't indiscriminately go on strike or propose down tooling. We take our time as patriotic Nigerians. We also try to utilize the platform of dialogue to to handle our issues. But when dialogue fails, that's when we now come on with the confrontation. Like the issue of COVID allowance or inducements that was paid, some of our members were paid. There were some who were entitled to it, but they were omitted. And their names had been submitted to the appropriate agencies through the Federal Ministry of Health. But up to this moment, we have been receiving various assurances from the Federal Ministry of Health that their issues will be handled. But till this moment, as we have assessed, they had not been paid that hazard allowance. So it is disheartening to know that those who place their life on the line during that period had not been remunerated accordingly. So it's part of our demand. Since the list is available, it's the responsibility of the agencies concerned to pay them. Okay, well, and then you ask, why is it that we put up our demand and eventually the strike now? You know, there are rules of engagement. The labor law gives us the latitude to give a 15-day window of opportunity for our employer to look at those grievances or demands that have been placed on the table. And within that 15 days, it is instructive, if they really are sensitive and are willing to meet our demands, to call us for negotiation and even find a way of implementing those demands. The one of the adjusted course is even the easiest, because the technical committee that is referred to as the high-level body committee put up by the government had done a beautiful job, done the recommendation, and the amount specific for the payment of these adjustments of salary had been proclaimed in that report. It was the responsibility of the minister now to take it to Mr. President. And you had, during the last FEC meeting, that Mr. President said up until 29th day of May, they are still in charge. The ministers will be in charge. He, as the commander-in-chief, is still the chief commanding the officers. So we felt that it is another call for the minister, if he desires that our issue is very sensitive, he can at that moment take it to Mr. President for approval, and it will be done. So that's why we felt it's important that we declare the strike. Then secondly, the incoming government should also see it. If this outgoing government is unable, but we pray that it should not be a negative story on the tenure of PMB. He has the wherewithal at this hour to even instruct. We believe that he can do that as the commander-in-chief. But if everything fails, the incoming government of our president-elect, His Excellency Bola Ahmed Tinubu, should see this as a very urgent need for health workers, because one of his mantra or the agenda he has proclaimed is that he will make sure that the health sector do not have crisis, and that the workers and professionals therein will be well remunerated. to assuage the issue of brain drain and this Japa syndrome. So we want he and his team to inherit these demands, especially the flagship demand, which is the adjustment of Conhe's salary.
All right, okay. So you have pressed up all these demands amongst others. Okay, so lastly and very quickly, with all these demands, if it isn't met, what is the association planning to do way forward to make sure that these demands are met and met in due time?
Well, the way it is now, we have declared a trade dispute. And when trade disputes are declared, then the conciliator should take over. The Federal Ministry of Health is the chief conciliator, and we believe that with them, they will do justice to it. But if the situation tarries and our demands are not met, since it's an indefinite strike, the strike will continue. But it will have a negative toll on poor Nigerians who may not have the financial capacity to go to private health facilities or to jet out of the country to seek health.
All right,
it's just a poor situation and a bad situation.
Thank you very much. All right, sadly, we've come to the end of the show today. It's News Up Extra, Silverbird News 24. Stay tuned to another interesting episode. Of course, we are already on the countdown to the inauguration. Okay, so that is the association.
Joesu, the Joint Health Sector.
Yes, sorry about that, Dr. Ogbonna.
Thank you.
Thank you very much for coming on the show.
Thank you for having me.
All right. I remain Atinuke Tukuranoke. Join us next time. Thank you.